benefits for any organization to adopt ERAS, knowing that it's beneficial for patients, but what's in there for the organizations, hospitals?
There are two things. The first thing is really that as an organization where you want to get people healthy again, that you get more satisfied to see that you succeed because the results are better than with traditional care. The other benefit for the organization is economic, because you save a lot of money because of less need for hospitalization and also less complications. So there are benefits for everyone, which is quite unusual in healthcare, because every time you have a new treatment that has some benefits, it always costs extra money. Here you have a concept where you improve quality of care and you save money.
Which should be easy to engage stakeholders and also leaders on this. But is it from patients that are expecting to stay in hospital 4 days after surgery, if they are discharged 2 days after surgery, is it hard to engage patient and families as they will be discharged earlier? Is it a barrier or an enabler?
It depends on when you talk to the patients. If you talk to them about early discharge on the day of discharge, you have a problem. They have to understand that this treatment is totally different from what they have heard about before. So one of the really important components of ERAS programs is information to the patient and relatives ahead of time, ahead of the operation, so they know exactly what is going on and they know exactly what we expect them to participate in to have a better recovery. So it must not come as a surprise with the discharge. It's all planned.
So basically it's more than engaging healthcare providers, it's really as well engaging patient ahead of time and families that makes it successful.
Yeah. And another key element here is that everybody in the healthcare system has to say the same thing. Because if the patients hear different things as before, they feel insecure, and that can spoil the program.
It's more like a team approach, so some great cohesion seems to be part of the success. Is that correct to assume this?
It has to be a team approach for many reasons. First of all, as I said, we need to say the same thing to the patients, because then they feel secure. The next thing about the team approach is that each profession has specific knowledge that is important to enhance recovery. So it's a team approach between anesthesiologists, between surgeons, between nurses, physiotherapists, everybody involved in the care program. And one organization or one profession cannot do this alone.
And for all of these professions, patients, families, leaders engaged, do we have objective data on their satisfaction being part of this? Is it considered to be more work, or it's how is the satisfaction for any of these stakeholders if it was ever measured?
There's a lot of studies to show that patients and stakeholders, they are very satisfied with these programs because it's so obvious. You see how the patients recover and are better, so everybody is more satisfied.